So we look at luxury branding. And with luxury branding, you tend to see that with increased pricing, so if you increase your price, you get less demand. Well, with luxury branding, it's the other way around. You increase the price and there's more demand. And that's called the Veblen effect. So you have this weird effect of, in fact, companies like, Burberry and Rolex reducing their supply. We all know they create artificial shortage. And as a result, they keep increasing the price. And that increases the desirability of the brand. And I want to say, very important thing, many dentists think that tomorrow they can go in and they can charge premium prices, luxury level prices. Well, you need to organize your luxury experience for the patient, right? So if a patient comes in the practice and the receptionist doesn't look at them, or they ring the phone and no one picks up, right? And they ring 6 times and there's just no, they get an answering machine and there's no out of hours service, there's no aftercare, and they get in a treatment room so full that they have to keep standing and they have to wait 40, 50 minutes for you to be done with your patient before you can see them. See, that's not a luxury experience. That's inconsistent then with you wanting to charge luxury fees. So the whole experience has to be designed, and you need to take ownership of that. As an associate dentist, yes, absolutely. Right. But you'll tell me okay, how can I organize receptionist? Well, you gotta take the leadership there, that you have leverage, right? You are part of the practice. You are a practicing dentist. And as a result, when you start talking to the practice principal and you talk to the receptionist and the manager about improving the experience to patients so that you can charge more, I think every practice owner will welcome that. The question is, are they happy to invest in that improved experience? So luxury branding talks about storytelling and, the whole experience and the craftsmanship, and we can use some elements of that. Scarcity is a dangerous thing, but I think with the right ethics and practicing in a way that is aligned with your values, you can achieve some sense of scarcity where you say, for example, we work on Saturdays, but the Saturday slots are for certain types of treatments, right? And you can decide that it's your operations, it's your time. But you don't have to open every Saturday for whoever comes in. That's your decision, right? You are running the practice. Well, you are running your own business. So it needs to be, yes, aligned with your values, but it doesn't mean that you have to see everyone, right? You have to set your boundaries and you have to be very clear on how you can create, for example, wait lists. You can limit your availability, right? So instead of open anytime, right, you can have certain slots that are available for this type of treatment. And, visiting specialists do this, right? If you work as an associate specialist level, you come in once a month, twice a month, 4 times a month on a Monday. And patients will be like, well, I'm working on a Monday. It's like, well, that's when they come in. You got to take time off, or you got to make some time to see the specialist. Okay. And patients actually take time off to see the specialist. So that's the scarcity as strategy. Now, how do we organize expensive and how do we organize high quality? Well, quite often patients understand or interpret expensive as something that has high quality, because patients look at something that has a high price and immediately look at it and say, well, it has a high price because it's probably is justified. And then they come in your practice and they get the luxury experience and they're like, yes, this is consistent. But then they get in your surgery and you're abrupt and you're rude and you don't listen to them, and then that's inconsistent, right? The whole experience has to be designed in the right way. And every single element, and this is why I tell you, and I really mean this, immerse yourself in growth. It's not just one element. It's not like I give you several tips and tricks and then you go and you implement them and you're like, yeah, happy, but then I still get the complaints. Yes, because you haven't worked on your communication skills. Or my nurses don't know what to do. Well, you haven't worked on your leadership skills. So you got to be a complete dentist, focusing on all aspects of dentistry, including the non-clinical side of things. So how do we signal quality, a premium, a luxury? We first start talking about outcomes. We do not talk about a porcelain veneer. We talk about the smile. We talk about the confidence that this will give a patient. Yeah. Secondly, I have seen so many dentists posting on Instagram pictures that have poor light quality, low resolution, and it's really not worth posting. and it's not worth even showing in your portfolio. So if you want to offer a premium service, you got to invest in, high quality, DSLR camera, your lighting, your background, everything has to align. You can't expect patients to pay more for something that is less than professional level photography. And of course, you need some anchoring of your credentials. So we need to kind of work on your authority markers.